We're due to make a decision in the next month and a half, 2 months, on whether we bring social care services into the new trust, and I'm confident that we will. What that will mean is a more seamless delivery. It will mean everybody is pointing in the same direction. It will get rid of this crazy idea that 2 or 3 professionals go up the path of number 68, followed by another 2 the following day who didn't know the first 2 came along. It's that simple. This is real people who are being not really treated in the way that I would expect a blue chip company to be treated. I think that there is no difficulty whatsoever with expecting the services that the public sector provide, including health, including social care, to be done in a way that is absolutely consumer focused. That was my business before I got involved with this, and I had some personal experience which was very powerful for me, not in Staffordshire, in a different place, when my father sadly and very suddenly had an awful stroke, a massive stroke, in a different place to Staffordshire. But I found firsthand the terrible disconnection, the fact that things didn't join up, the fact that, as Nigel quite rightly said, you were pushed from pillar to post at the most difficult time for a family to be coping with a major health crisis of somebody that we love. And so that set me in very good stead for understanding a little bit more about why we need to try and join things up better. And I have to say, hand on heart, that my experience at the time when my dad became ill was actually, it seemed as though people didn't care. It seemed as though nobody was bothering to talk to each other. But actually it was the organisational barriers. It was the different ways that social care do things to the ways that health do things. And it wasn't that the social care professionals didn't want to collaborate with the health professionals. It was that the organisational structures made it very, very difficult to do so. So bringing things into one trust, joining up the teams, creating this more seamless front end, which combines personal health budgets with social care budgets and really looks at people in a holistic way, just the same as we're trying to get rid of this transition between children and adults in Staffordshire, so that we have a whole of life service, so that we don't compartmentalise and pigeonhole people into different places. I think it's a really powerful statement, and I'm really confident and hopeful that we can actually make it work.